My name is Bob, and I'm helping John out with the sister video to his video. This one is called Quinolone documentation, and I'm going to turn it over to John.
The first piece of documentation that we have concerning quinolones comes from Dr. David Flockhart, Professor of Medicine and Chief of Clinical Pharmacology at Indiana University School of Medicine. And he says as many as a third of patients taking a quinolone will experience some sort of psychiatric side effect, such as anxiety, personality change, or confusion, and that there are reports of these conditions becoming irreversible. I'm going to hand this piece of literature to Bob for him to put up on the YouTube screen. And keep in mind that we don't have the dollars that a big pharmaceutical company has, so it's very hard to center and align this properly. But if you can just pause your video camera and put it on pause for about 5 or 10 seconds so that you can make sure to read this.
1/3 of patients, it's absolutely amazing. 1/3 of people taking this class of drugs will experience a psychiatric side effect. That's a fact, and that's what happens.
The next piece of information is the PDR, the Physician's Desk Reference, and it lists some of the side effects of Levaquin, and some of them are here. For example, heart attack, heart failure, hallucination, lung problems, liver disorders, kidney disorders, paralysis, pneumonia, seizures. It's a pretty scary side effect list.
Again, as John said, this is the Physician's Desk Reference. You can see at the top PDR. And every doctor has this in his office. Now, chances are, if you get these side effects, most of us have been thrown out of the doctor's office. We've been called psychosomatic, and we're not believed, we're ridiculed. The doctors are so arrogant and lazy they won't even open up the PDR and read the documentation from the manufacturer to see what's really going on. That's very irritating, believe me.
The next piece of information is the package insert of Levaquin, and this is information that comes directly from the manufacturer, Ortho McNeil, and it says that under the adverse reactions site that this antibiotic can cause pain, burning, tingling, numbness, weakness, and that this can lead to an irreversible condition. And it mentions tendon effects, ruptures of the shoulder, hand, Achilles tendon, or other tendons that require surgical repair or result in prolonged disability have been reported in patients receiving quinolones. And again, Bob is going to put that up, and if you can just...
Yeah, this is a package insert. This comes in the box with every box of Levaquin, and you won't get this at the pharmacy. They won't give this to you. But it's just more evidence. It's just more facts. If you're suffering from any of this stuff, please look in your medical, any of these symptoms, please look in your medical records and see if you've been on quinolones. And if you haven't taken a quinolone, please don't ever take one. It's not necessary.
The last piece of information is from Dr. Jay Cohen, and this is a letter to a congressman on the severe disabling reactions linked to these antibiotics, and he calls for black box warnings on these drugs. He has a study in which side effects occur in patients at the rate of, for nervous system symptoms, 91% of patients had symptoms in that category. 73% of patients experienced musculoskeletal side effects, and cardiovascular symptoms were reported in 36% of patients.
Again, Dr. Cohen is an expert on fluoroquinolones. These are facts, people. These are facts. These drugs are very dangerous, very deadly. I personally know people that have committed suicide because of these drugs. I personally know people that have been in bed for over 10 years in pain. I myself am in my 7th year of incredible suffering so bad that I can't work, just because I took fluoroquinolones. So if any of this stuff is in your life, please check your medical records and make sure that a quinolone was not administered to you. They even administer them to you in surgery. So if you had a knee replacement or any surgical procedure where you were put to sleep, they give Levaquin now intravenously, unbeknown to the patient. And I've had patients call me that went in for minor surgeries that have come out an absolute mess because of the IV Levaquin that they got in the hospital. This is just some of the evidence that we have. There's much more. We'll be producing many more videos. YouTube has a very short limit on video, so we can't really go too much longer. If anybody needs any help, please go to fqvictims.org, and there's a phone number there. It's toll free. You can call it. We will get back to you or answer the phone at the time, and be glad to try to assess what's happened to you and give you any information we can to make your suffering as minor as possible. Thank you for your time, and God bless.